Hi, this is Eric Stoller. We're here at the Eric Stoller Show Patient Zero series. I'm here with Dr. Gill Mejia, the founder and runs Rejuvenate Your Life. You guys are based in where in Florida?
Tampa, Florida.
Tampa, lovely Tampa.
Yes.
I love it. I love it. So tell me a little bit about your location, Rejuvenate Your Life, and what you specialize in helping patients achieve their optimal health.
So I'm an internist. That's my background.
Okay.
But we added other specialty because there's no perfect specialty. So we added nutritional medicine, weight management, anti-aging medicine, functional medicine, and yes, sexual medicine.
Sexual medicine.
Yeah, as a matter of fact, we now have about 100 doctors under my care and about 500 nurses under my care.
So hold on. You're not only treating just average people, you're treating lots of physicians and nurses.
Yes.
Wow. So let's talk about that a little bit. You talked about, nutritional health. So talk about what are the things in nutritional health that you either specialize in or recommend for people that they need to be on the right track.
Anti-aging and for weight loss and even sexual medicine. The basic is just about healthy diet, fitness, stress management, and yes, sleep. Because I could do everything. If you're not sleeping, it's going to be so hard.
Yeah.
But as far as nutrition, I recommend what we call the anti-inflammatory diet.
Okay.
Because a lot of food has so many toxins, so many added chemicals that would cause inflammation. And these inflammations are the one that leads to the obesity epidemic in America, the high blood pressure, the diabetes, the autoimmune disease. So what we're putting in our body is very important.
And I think most people are, like you said, they're on the go, they're stressed out, they stop at the fast food joint, they're not thinking about it, what they're eating, they're just eating something.
Right.
And then now they're coming to you, they're overweight, they're not feeling their best. And I'm not even just like the average person, but also I'm sure some of your medical professionals, they're overworked.
Right.
So when somebody comes to see you, what's the first thing that you try to do with them so you can find where they're at to help them?
Well, obviously, we do a lot of consultation. I have to know the patient, their medical history, their past history, the medications, because some medications can cause some issues too.
True, yes.
Their family history, their genetics is part of it. So we do general assessment, including blood work.
Okay.
And yes, you could be eating healthy, you could be doing all those basic things, but as we get older, we feel different. We get old not because we're 30, 40, 50, 60. We get old because our hormones are declining. And that's what I do. I make your hormones like a 20, 25-year-old again.
All right, so let's talk about that, because I know we had a little conversation about it the other night. And so talk about how you're helping people get their hormone levels to the right so they're feeling like they were when they're back in their 20s.
So one thing is that when I was practicing internal medicine primary care, I was already prescribing a lot of hormones.
Okay.
But I was prescribing a synthetic hormone.
Okay.
I don't prescribe them anymore because they could actually the one cause a lot of side effects.
Wow.
What I prescribe now is a natural bioidentical hormone, which is the same hormone as when we were 20, 25-year-old.
Wow. And is this done through either injections or is it something?
Well, there's so many delivery systems.
Okay.
They all work, but the difference too that what I do now is that I make your hormone, as I said, like a 20, 25-year-old, and the normal hormone level are very wide.
Okay.
And what we do is we don't just make your hormone normal. We want your hormone to be an optimal. That's the 20, 25-year-old.
Sure.
And that's the upper third of normal, because that's where you perform better with your career, with your education, with your businesses, with your love life. So that's very important.
So again, getting people in an optimal performance. And let's talk about, we talked about the other night too, about the sexual health.
Yes.
And you even made a comment that, having sex is like anti-aging. It's part of
Yes. So why do we have sex? So
Sure.
if you look at the dictionary, we have sex for procreation. But how many of you guys really have sex to have more kids?
Yeah, not many, right?
Yeah, not many. We want to have sex because it's pleasurable, right? But if it's pleasurable, how come a lot of you guys are not doing it every day? There's so many reasons for that.
Sure.
It's number one is the hormone decline, and then of course it's aggravated by other things.
Absolutely. And just life and people getting so busy and not making that a priority.
Right.
And I
So
think
and there's so many benefits of having sex. It's it you live longer, you feel happier, your immune system goes up, and it's considered an exercise.
yeah, I mean, so there you go. I mean, sometimes, you gotta tell the wife what it is. It's just she doesn't want to do something tonight, right?
Right.
So it's kind of funny, but it's not because it's true. You think everybody wants to live longer, feel better, and that's such a simple thing,
Right.
right? And you had mentioned that you have clients that are in their 80s that are having sex
Oh yeah,
regularly.
definitely.
Where people say, "How is that possible?"
Yeah.
But how is that possible? Because
Yeah, so it's something to do with the testosterone. See, a lot of people, even a lot of doctors, are not aware that female have testosterone. The major sex hormone of female is also testosterone.
wow,
70% of my patients on testosterone in the office are
wow,
female.
wow,
So, it has the same manifestation as male, and it has the same symptoms as low testosterone as male. They're going to be tired, fatigued, they don't have a lot of motivation,
yeah.
they have joint pains, body aches, headaches, and their sex drive is much lower than the male.
It's very low.
Right.
Right.
So who wants to have sex if they're tired and they're fatigued, and also they're having some dryness down there?
Right.
So I fix all those things. That way, when you retire, you're so happy and everything is just
It's going great.
gracefully. You're getting old gracefully.
Which is wonderful because a lot of people don't age gracefully
Exactly.
and the body starts to break down.
Right.
And I think maybe it's just a fallacy of life that we think that that's it. We're kind of
Right.
we can't change. And
Yeah.
you, with your years of experience, are like optimizing people's health way into their later
Right.
years in life when they think that's it. They're too old.
Right.
So
So a lot of people think that it's natural and they don't want to be bothered about it. But when they sit down with me, they know that they need some changes. They can't just be, accepting what what they feel right now, because there is a lot of things that we could do to make you feel much better.
exactly. And so, with that being said, if somebody wants to connect with you, consult with you, come visit you, how do they go about doing that?
Yes, actually, you could just go to my website, drgillmejia.com, and you could make an appointment from there. You could book your appointment from there. What I'm gonna say is that really the best sexual medicine is one of the best medicine.
There you go. That's the final word right there. Eric Stoller with Dr. Gill Mejia, Rejuvenate Your Life, based in Tampa, Florida, for the Eric Stoller Show and the Patient Zero series. Dr. Mejia, thank you for doing this.
Thank you for having me.
Such a pleasure. Thank you for the insights. And remember, having sex is a good thing. And take care of your health. Come see Dr. Mejia. He'll get your hormones right and take you to that next level to be optimized for your best life ever.